My name is Saad Omer. I'm the director of the Yale Institute for Global Health, and I'm also a vaccine scientist. I want to talk to you about a not so good news. So according to this UNICEF and WHO report, we have seen a substantial decline in childhood immunization rates around the world. As you know, vaccines are some of the most effective methods to control infectious diseases and increase child well-being and health, and most importantly, survival. Vaccines have played a major role in decreasing death that was used to be associated with early childhood. But now, during the pandemic, we saw substantial decline in vaccination rates. In fact, between 2019 and 2021, approximately 67 million children missed out on routine vaccine. So look, it's not just a sort of an administrative number. This has actual impact on lives. Last year, the number of measles cases worldwide were twice as much compared to the previous year. And paralytic polio increased by 16%. It is our collective responsibility as the global community, as individuals, as the citizens of this country and the world, to make sure that the tools that were available to us in our childhood to protect us from infectious diseases continue to benefit children, and on our watch, we don't have further backsliding on immunization rates. What can we do about this? Well, we can do a few things, both as individuals and as parts of various communities. For example, if you're an employer, make sure that your employees who happen to be parents know that they can take time off work and get their children vaccinated. If you are parts of a business that has the ability to provide locations for vaccination in any part of the world, go out and reach out to your local immunization center to say that, is there any benefit in setting up an immunization clinic? Because right now we are catching up on these missed vaccines. As citizens and as voters in certain cases, we want to make sure that our political leaders are aware of the need for vaccination as a priority community intervention. We need to talk to them about adequate funding, adequate resources, adequate effort, and them being examples to their communities. And those of us who are in high-income countries want to make sure that our governments continue to provide resources to entities like UNICEF and Gavi, the Vaccine Alliance, as well as other governments, for increasing and sustaining immunization rates. And most importantly, we need to make sure that misinformation and disinformation about vaccines does not spread any further. And we can do that by being part of communities in a way that we share the right information, we share the authentic information provided by healthcare workers. And as I said, it is our collective responsibility to make sure the most vulnerable amongst us, i.e. children, are not increasingly vulnerable to common infectious diseases.